Welcome everyone to the first episode of Mental Health Explained. In this series of podcasts, we'll be learning about many mental disorders and all about them. In this episode, we'll be taking a look at depression. Depression is a serious mental disorder that can affect anyone of any age group. Depression is a mental disorder which can affect a person physically, mentally, emotionally, and socially. People who suffer from depression often experience intense feelings of sadness for extended periods of time, ranging from weeks to months to even years. The people diagnosed suffer from multiple more extreme symptoms such as insomnia, self-harm, and even attempted suicide. In the past couple of decades, more and more people have been coming out and being diagnosed with this condition, showing more alarming statistics. One of the main statistics gathered from this is that 1 in 5 Australians aged from 16 to 85 will have some form of depression throughout their life. Now we'll talk about how the illness is caused. Doctors and researchers have found no particular cause to depression, but psychiatrists have been saying that there are many things that can cause it. Some of these things are physical abuse, mental abuse, extreme grief, substance abuse, and even uncontrollable triggers such as genetics and family history. These wide range of ways someone can get this illness makes it hard for doctors to pinpoint exact scientific reasons. Next, we will talk about how to prevent depression naturally without any medical help. Now we have Dr. Smith here to help us to discuss how to prevent depression. So doctor, how can we prevent depression?
To help prevent depression, there are many things you can do. Most of the things you can do mostly occupy you in life, or try to help show you a reason to live your life. These things include getting enough sleep, exercising, staying in good health, trying to improve your friend network, and most importantly, to try and find passion in your life. You may be doing all the right things to prevent depression, but having a sense of purpose in life or a will to live will increase how happy and how you feel about yourself and your life. According to www.bluezones.com, people who have a purpose in their lives live for up to 7 years longer than people who do not.
Thank you for your time. I will now talk about how to notice depression in family and friends and how to help them. If someone you know may be suffering from depression, there are many ways you can notice and help them. Some behavioral signs of depression include not joining in on social activities, withdrawing from family and friends, not doing any enjoyable activities that were once enjoyable, or being unable to concentrate. Some emotional signs are if they are constantly feeling overwhelmed, guilty, frustrated, and unhappy. Some physical signs include being tired all the time, sick and run down, loss of appetite, and significant weight gain or loss. The people suffering from depression experience all of these symptoms due to their lack of will to live and their consistent tiredness. Some more extreme symptoms are the constant covering of the arms trying to conceal self-harm wounds or attempts of suicide. In cases like this, your best option is to call a mental health line for your friend. Many exist, but more popular ones are Self-Harm Line on 13 11 14 or Beyond Blue on 1300 22 4636. If you or your friend are in an emergency situation with self-harm or suicide, the best number to call is 000. In conclusion, if you or someone you know are currently suffering from depression, the best thing you can do is to get some help from a psychiatrist or talk to family and friends about it. In our next episode, we'll be learning about and discovering anxiety. Stay tuned for our next installment of Mental Health Explained.